Hi, my name is Deanna Gorgi. I'm a third-year DO student at the Philadelphia College of Osteopathic Medicine. And today I'm going to talk about the effects of nutrition education, portion control, and behavior change on health and weight loss. Before I begin, I'd like to thank Dr. Farzana Diki. In the United States, obesity has become a public health crisis. It affects over 40% of adults, is associated with increased mortality, and is the primary indicator in the rise of metabolic syndrome, which is a cluster of conditions that increases your risk for cardiovascular disease, stroke, and type 2 diabetes. Given the increasing rate of obesity, efforts to change unhealthy lifestyle behaviors in overweight and high-risk populations are imperative. In our prospective cohort study, our group developed an intervention based on portion size awareness and physical activity while focusing on motivating participants towards behavior change. Participants recruited from the PCOM community attended group sessions and monitored their daily food intake and physical activity through daily logs known as the Health Passport. A total of 27 adult participants completed this program over 4 cohorts with minor amendments to each cohort protocol. In Figure 1, you can see the measurements taken at baseline and upon completion of the program broken down by cohort. All 4 cohorts completed 10 weekly sessions, and cohorts 2, 3, and 4 had an additional 5 bi-weekly sessions. A post-study assessment was conducted at least 6 months after completion of the program, and at that time, self-reported weight was collected. In Table 1, you can see that by week 10, we saw statistically significant decreases in weight, BMI, waist circumference, diastolic blood pressure, glucose, and HbA1c. Participants lost an average of 8.12 pounds, which amounted to an almost 4% reduction in weight. Figure 2 shows the percent weight change from baseline by session. Participants lost weight at the rate of 0.7 pounds per week during sessions 1 through 10, and then during the additional 5 bi-weekly sessions, they lost weight at the rate of 0.12 pounds per week. This decrease may be due to the decreased accountability with bi-weekly sessions, perhaps due to the less frequent facilitator contact and group participation. So now that we learned that our intervention resulted in significant weight loss and improved health markers, we wanted to know if that weight loss was sustained at follow-up. And if so, why? Follow-up surveys were completed on 14 participants. Of these 14, 9 maintained their final weight or continued to lose weight, and 5 gained weight. We did linear regression analysis to assess whether there was a correlation between adherence to the program and weight loss. In Table 2, you can see the factors that we considered for adherence to the program. In Figure 3, you can see that there was a statistically significant moderate correlation between the number of health passports submitted and weight loss at the end of the program, with an R-squared of 0.41. Participants who completed more health passports lost more weight during the intervention, suggesting that frequent self-monitoring is one factor that contributes to the successful weight loss during the program. We also wanted to know about those participants who were able to continue losing weight after the end of the program. In these participants, there was a weak correlation between the readiness survey and successfully maintained weight loss at follow-up that was not found to be statistically significant. It's interesting to note that this correlation was not seen during the program, suggesting that inherent motivation and preparedness may be less important during the intervention, but might be more crucial to long-term weight loss. No other factors were found to significantly correlate with weight loss at follow-up. However, the participants who lost the most weight at follow-up continued to self-monitor, either using the Health Passport or something similar online. In conclusion, our results demonstrate that significant weight loss can be achieved in patients who are overweight and obese following a nutrition education intervention. Further research could provide insight into why some individuals are more successful at maintaining weight loss and healthy behaviors by investigating the effect of self-monitoring for longer durations during post-intervention. Further studies could be expanded to include participants outside the PCOM community to see how these results translate to underserved communities and the unique challenges they face.